Starting from the very basic breast augmentation, where a woman has low self-esteem due to the inadequacy of breast size, where she's all the time struggling with her self-image, and in today's competitive world, obviously there's a need to look prim and proper, look better, and it is in general a part of their well-being. So breast augmentation, to divide it in widely, it consists of many kinds of breast augmentations are there, like breast augmentation with implants, breast augmentation with fat, breast reconstruction after surgery is also a kind of augmentation. Breast augmentation with implants can again be divided into saline implants and silicone implants, of which the silicone implants are by far the most popular. And it's almost like a daycare surgery where a patient walks in the clinic and can get an augmentation done. In most of the cases, drains are not put, so she can even leave by the evening once she is out of anesthesia. And she can resume her routine activities in about 2 days' time. And it's a very, very popular procedure. And obviously, in detail, the methods, even in silicone implants, there are different approaches to putting the implant, be it the axillary method or the submammary. It is a matter of discussion between the patient and the doctor, and also the suitability of the patient to a particular procedure, that they zero down upon a particular method for a particular patient. In the saline implants are also popular, however not as much as silicone implants. And they are again the same, although in the saline implants the process is a little more longer because the saline inflation has to be done. The implant inflation has to be done on a routine basis. About lipofilling, lipofilling is, as I always mention, it's a new kid on the block in plastic surgery, and relatively new, I would say. But lipofilling is suitable for women who are ready for a staged procedure of their augmentation, because a lot of increase in size of the breast is not possible in a single sitting, because the fat that has been transplanted has to survive, and for that it needs vascularity, so we cannot make the pocket too tight. And in lipofilling, approximately for 1 cup size increase, you would need on an average 2 or 3 procedures separated by about 4 to 6 months each. And in lipofilling, again, it is suitable for women who have fat in their body. The donor areas can be abdomen, thighs, gluteal regions, wherever without hampering the body contour, the fat can be harvested. And the fat has to be filtered, it has to be prepared to be injected. So it's a labor-intensive procedure, lipofilling. About breast reconstruction post mastectomy or post breast cancer excision of the breast. Again, a lot of procedures are in the offering. And starting from the simple LD flap, where we take skin and fat from the back and transpose it to the anterior part to reconstruct the breast, which later in most of the cases have to be augmented by implants or saline implants or silicone implants. Then there are obviously there are pedicle flaps where tissue is not transplanted as a free tissue. In a free tissue transfer, we need microvascular procedures, like taking the example of DIEP flap, which is by far becoming the most popular procedure for breast reconstruction post cancer. And DIEP is a very, very safe procedure, and it offers tummy tuck as an collateral advantage that the woman gets, and the tummy is also shaped, and that tissue is taken from the abdomen is used to reconstruct the breast. It's a microvascular procedure. It needs in-hospital stay, and the patient has to be counseled, has to be explained about everything. So it needs an in-detail discussion with the cancer surgeon as well as the plastic surgeon.